I want to share the latest data from our partners at Regenstrief regarding the statewide hospitalization and recovery data. Regenstrief has looked at over 47,329 cases this week. Of those, about 25% visited the emergency department, which is steady from last week. A total of 7,333 were hospitalized, which represents 16% of all the positive cases. This is also basically unchanged from a week ago. Of those who were hospitalized, 21% were admitted to the ICU, which is consistent with what we've been seeing in past weeks. This represents 3% of all positive patients. 74% of hospitalized patients have been discharged, which is steady since last week. Of the remaining 26%, 7% are believed to still be hospitalized, and nearly 19% are known to have died while hospitalized. Regenstrief also estimates that 78% of patients have recovered, which is the same since June 30th. We continue to monitor the data surrounding our 4 guiding principles for our phased reopening: hospitalization, surge capacity, testing ability, and contact tracing. What concerns me is that we're seeing more overall COVID-19 infections. Our current positivity rate is increasing, meaning that of the Hoosiers tested for COVID-19, more have had positive results. The 7-day average positivity rate in Indiana was 5.9% through July 4th, but the single-day positivity rate on July 4th was 6.4%. The rate has steadily increased. By comparison, our lowest positivity rate was on June the 18th, when the 7-day average was 4.1%. With more cases, we're also beginning to see an uptick in hospitalizations over the last few days. On July 7th, 667 COVID-19 patients or persons undergoing testing for COVID-19 were admitted to hospitals across the state, up from the low of 595 patients on June 26th. As we've talked about before, the positivity rate is one of the key principles driving our decisions for the Back on Track Indiana plan. The rates of positive tests have been rising in specific areas throughout the country, and we're also seeing a few localized hotspots in a handful of Indiana counties. We anticipated this, which is why we paused the reopening plan last week, and that decision has been confirmed by the numbers that we've been experiencing. When we moved to stage 4.5 last week, we kept many guidelines at stage 4, but we also opened some larger activities such as festivals and camps as long as social distancing, masks, and other prevention plans were in place. But in consultation with the Indiana State Department of Health, and following the slight uptick of COVID-19 cases, and after having discussions with us, the Indiana State Fairgrounds and Northern American Midway Entertainment has decided to cancel the Fairgrounds Fun Park that has been planned for July 31st through September the 7th. The carnival provider and State Fairgrounds had a thorough and very thoughtful plan on how to conduct the event safely, but have concluded that it's best not to move forward with the fun park. Smaller 4-H livestock shows will be conducted at the State Fairgrounds. I'd like to remind Hoosiers, whether you're planning on attending an event or just planning to attend an event where there will be lots of other people, please stick to the safety plan that you created. Wear a mask, keep socially distanced, wash your hands frequently or use hand sanitizer. Stay home if you feel sick, and of course, get tested. Those strategies are there to help protect yourself and each other from infection while enjoying some very long-awaited fun and entertainment. Thank you.
Well said. It can't be said enough, I guess, though. As good as the plan is, and we've seen a lot of good plans, they got to be followed.
Exactly. And I can't tell you the number of times we've seen through contact tracing that people have said, we had a great plan, we just didn't follow it.